Okay. Yeah, it's nice to have the opportunity to speak to you because when I heard about this society, I thought, great, I'm very pleased to hear it. And then I was speaking to Nick and I said, why do they call it global health? Okay. So what I'm going to try and do is give you some sense of the background of the evolution of some of these ideas. And actually, they're really movements now in health. So I hope it's helpful to you to get a sense of what you're trying to do. So I'll give you an overview of these concepts, and that's going to be the boring bit. And then I'll talk about what's actually happening practically, globally, to try and sort out some of these issues. And talk a little bit about the state of health systems, because in my opinion, they're pretty broken. Actually, they need fixing. So we'll talk a little bit about that, and really what we need to do in terms of the One Health thing to sort of get it to have more impact. And then we also need to be able to measure it and obviously the implementation processes. Okay, now the first bit's going to be pretty boring, okay? So just bear with me, but I think you need to have it. It's one of these things. Without it, you're not going to be really equipped to think your way through this process. So when we think about human health, okay, it goes back to 1946 when the WHO said a complete state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. When they wrote that, they thought they were absolutely, tops and up with modern thinking. But of course, it's moved on from there now because that was really pretty limited. And it's taken account now of changing health needs. So, what a baby requires and what an old person requires is different. So we need to actually contextualize health and this culture, okay, as well. So it's not just about what the West thinks or the East thinks or the South or the North. We need to look at cultures and actually what's relevant to them in terms of health. And rights, actually, and it comes back to rights as well, and personal responsibility. And then we have gone further on to sociological determinants of health. So we recognize that tuberculosis is a disease of poor people. Okay? So that's socially determined. It's not a pathogen-host issue. It's a social issue. And that actually health is very important in the context of development. And then we developed this idea of population health. So it's not just about the individual. So this was the capacity of people to adapt to, respond to, or control life's challenges and changes. Okay, so it was really about the population and how it deals with this. And then the term global health emerged out of that. Okay, which is an area for study, research, and practice that places a priority on improving health and achieving equity and health for all people worldwide. Okay, it's people-focused global health. Right? As a movement, as a activity around the world. So there's confusion. Sometimes people think global health is One Health. It's not. Okay. Global health is very specific. It's about human health. Now, doesn't mean that vets and other people can't contribute to human health. Far from that. Okay, they can. Of course they can. And if as a society, that's what you want to do, you want to orient everything towards improving human health, then that's what you do. That's global health. Okay, in the context of social determinants, population health, and so on. All right? So that's important you understand. Environmental health is another term that's used, okay, in relation to some of these things. It's a branch of public health that's concerned with all aspects of the natural and built environment. In fact, there's a bias towards the built environment. That's about architecture, sewage systems, reticulation, things like that. But it's in relation to human health. So it's not actually about environment. It's environmental health as it pertains to human health. Okay, so that's another one. Animal health. This is something you should know. But what's interesting is that most of the resources, intellectual, financial, and so on, has gone to human health. In some societies, we've dedicated a certain amount of resource to animal health. And in the UK, wealthy societies, relatively more is given to animal health. Okay? And what's interesting about animal health is that it's really, the definition is all around infectious diseases, which are of consequence to domestic animals and to humans. Okay? So zoonoses and economically important diseases. So this, I call it an ancient idea, is still very prevalent in our legislation and in our definitions of animal health. The idea that animals exist solely to satisfy human needs. I'm sure you as veterinarians or on the way to becoming veterinarians, that you don't think that. You don't think animals are just there for us. Well, I hope not. But it's something that we need to recognize, that actually we haven't even defined that aspect, which is outside of this narrow field. And it's about domestic animals, really. Okay, that's what animal health is about, and all the legislation around it. If we look at wildlife health, and that's something like my entire career has been about, wildlife health and ecosystems health. A guy recently tried to define a modern definition. And for wildlife health, it's about interacting biological, social, and environmental determinants that interact to affect capacity to cope with change. So it's about the resilience, if you like, in a population of animals, in the wild, that don't have some control on them other than the environmental controls that are there. And in the context of wildlife health, it can't be measured solely by what is absent, but rather by characteristics of the animals and their ecosystem that affect their vulnerability and resilience. Okay, so it's a very complex and dynamic thing. So you don't just have sick and healthy animals. It's much more complicated than that. So you don't treat animals in the wild. You don't have to, actually, in a sense, most of the time anyway. So it's not a biologic state, but it's a dynamic social construct, based on our expectations and knowledge. So we give it a characteristic. We say, that's a healthy population. This isn't a healthy population. Nature just gets on with it. It doesn't really define it. And then when we talk about ecosystems health, it's a metaphor, really. And it describes a condition of an ecosystem. So again, it's us putting saying, well, that ecosystem's healthy, this one isn't. Right? And we create parameters to measure on that. So it's important to understand that. Now, eco-health, which is a shortened form of ecosystems health, and it's a community of people, and they have a publication, and they have an association, and they have a global community that is trying to help. And it's promoting this link between animal, human, and ecosystem health. And then you have One Health. And again, we have a journal now for One Health, and there's a community of people who've been pushing on One Health. And why are these things happening? Well, it's because we're seeing some significant changes taking place, and we call them crises. And we're seeing increasing levels of disease, and a lot of them to do with human-induced environmental degradation, human behavior, and wide-ranging ecological changes. And the idea of this eco-health and One Health is about bringing different disciplines together, because we think that's important. So if you look really at what it is, it's an academic community connecting and debating on eco-health issues or on One Health issues. And actually, they're really the same. There's no real difference, actually. It's just different communities in a sense, with bias one way or another, but actually they talk very much about the same thing. So we talk about a paradigm that addresses complex challenges to promote the health and well-being of all species. Okay, so that's very different to global health. Very fundamentally different. Humans are simply one of the species that we should be concerned about. Okay, so it's really important we get that. And the environment. So we're concerned about the system that supports all these species as well. And we need all the sciences that are relevant at a systems level in order to do that. So that's what it's about. That's what, and can it provide the solutions? Of course, that's the question at the end of the day. We find with One Health that a lot of people have a bit of a narrow definition or narrow vision, and they think about the idea of threats from epidemics, pandemics, about disease, infectious disease. It's a very narrow vision that some people have around One Health. And then we have a broader vision, which is held more and more, I think, by the majority, that we really talk about public health, animal health in a much broader sense, food safety, food security, improved nutrition, livelihoods, and a balanced investment between human, animal, and environmental health, effort, including plants, a healthy planet, healthy people. So it's really trying to be comprehensive. The narrow vision tends to have the vets and medics in it. They're stuck in that sort of paradigm. And actually the broad vision is about the whole of society. Because the whole of society needs to look and realize that they're getting very unhealthy. They're getting unhealthy, the planet's getting unhealthy, and all the species in the sort of context of what we think health is. Okay? So, I advocate very strongly convergence in a way. So we try and say, yeah, of course we can have differences. A vet's different to a medic, and people, the guy who sweeps the street is different to a medic. Of course there are differences, and there are different disciplines, and that's fine. There's no problem with that. But we need a degree of convergence. Some people have tried to do this through a sort of planetary health mechanism, okay, saying that actually the fundamental is the planet. If we don't sort out those sort of physical processes that are, underpinning life, then of course, we're all stuck. So, it brings in then global health, and it's, from a human perspective, all that stuff about equity and so on. So, convergence is trying to bring them together. Disciplines can carry on in their own way, but get a common vision, okay, about what we're trying to do here. Okay, we're trying to be fair in a sense in how the resources of the planet, the systems of the planet, support life, human and other life. And why are we worried about this? Well, if we look at what is termed the Anthropocene, it doesn't matter what you're looking at, really. Okay, in a geophysical sense, in an air sense, in a land sense, everything is changing. Okay, so it's not like somehow we're in the same pathway that people 100 years ago, 300 years ago, 1,000, 10,000, 100,000 years ago. It's a different planet now because of what we are doing. Very fundamentally different. And so we have to have a different paradigm to deal with this. If we go on the way we were 1,000 years ago, we're in big trouble. Okay? And basically, we're not dealing with it. Population growth. Of course, population is an issue, and everybody says, the problem is population. I don't think it's a problem at all, actually. I think biologically animals reproduce, they expand until they get to a point with resources, then they begin to decline. So humans are no different in that sense, and the indicators are very much that we're coming to a point of plateauing, and that population is likely to start decreasing, perhaps in 50 years, maybe in your lifetime. You'll see a decrease in human population. So the indicators are showing that. The problem is the consumption patterns of each individual are still accelerating. So it's not a problem of how many children there are, it's what we consume. Okay? So, that in a sense is where we have to address. We have to address this to create a fairer world in terms of resources available. And if you look at the proportional mapping of things like climate change contributions, for example, okay, so it's one of those geophysical elements that is really important. It's disproportionate. So this is a map showing relative contributions. So, if you look at, I'm not sure if the screen picks it up, but so if you look at this continent here, okay, it's sort of very narrow and thin. It's not contributing to climate change. That's Africa. Okay, that's Africa, and it's a place where the most people are, and the highest population growth is. But they're not contributing to. Okay, you get my point. So it's the northern, it's the rich countries, it's the consumers who are generating this problem. Okay, so the solution must come from those people, which is you, okay, and me. It's not the Africans. And yet we keep telling the Africans that there's something wrong with them. Okay, there's something wrong with us, not with them, in how we behave. And it doesn't matter what you look at, what parameter you look at, that all shows similar trends. So this is, bottled water consumption. Okay? The most ridiculous thing. But it shows you how disproportionate the world is in how it consumes bottled water. And it can't be a good thing, then, because you're commoditizing water, you're making water something that really is a human right, something that you have to purchase. Really, really dangerous, I think, in the context of equity. And if you're interested in global health, it's a major issue. Let's look at mortality patterns. This is human mortality patterns. And we look at categories which the Global Burden of Disease has provided. you've got the old sort of communicable maternal perinatal nutritional disorders, which were category A, okay, declining. Anyway, category B, okay, which is proportionately much more important, okay, is non-communicable disease. And if you look at the increase, the relative increases that we're expecting, these are actually nothing to do with infections and things like this. They're to do with behavior, habits, what we eat, how we live. So our health. This is why I'm saying to you, we have a broken system. Because we have vaccines and we don't get smallpox, we think that everything's fine, but actually it's not. All right, and we have a lot of suffering and a lot of problems and pain associated with a system that we've created. And this is an example, and it's not just for humans. Right, this is now a feedlot system in the United States, 10,000 cattle managed like this. Okay, they're a herd species. They probably don't mind being in a big group of animals like this, but it does generate a lot of problems. This sort of agricultural industry. One of the problems is you don't see it. Okay, the people who eat the meat do not see it. Okay, so it's we're happy then to eat the meat because we don't see the suffering, we don't see the problems associated with a system like this. And many communicable and non-communicable diseases come from these systems. We are generating new pathogens, new problems continuously. Your avian influenza story, your H5N1, your H5N8, it's just continuing to happen. So it's a generation that is highly productive. We have systems that are highly productive, but we're also highly productive in terms of pathogens. If we look at wildlife, and I looked at some of the sort of burden statistics in related to zoonoses that come from wildlife. So people have this idea that wildlife's got lots of problems and it gives it to human beings. But you actually have to use a log scale to get a sense of direct infection from wildlife to people. It is such a small problem. It is such a minute problem, actually, globally. Even if you look at something like rabies, you see it's dogs, it's domestic animals actually that provide this. So wildlife tends to keep well away. It does its own thing. Occasionally you get some important spillovers, pathogen jumping, which has led to things like HIV, dengue fever, and so on. But it's actually the human environment, the domestic animal environment, that changes the pathogen or creates the pathogen, which then becomes a problem within our societies. Okay, and then I have this. We wrote a paper. If you're interested, there's a paper, and I was part of with some American colleagues, and then I did a veterinary record to sort of translate it into more easy to read. It's a bit heavy, this paper, but because it's really trying to intellectualize the whole process. And so we used examples, but just I don't think we've got time to go through all of them. But if you look at the way we deal with health, you can sort of put it in a pyramid. So you can look at the top of the pyramid is really about all the stuff we do in medicine. So the GPs, the hospitals, the drugs, the vaccines, actually where 90% of health actually is. Preventative medicine, which is part of the vaccination, obviously comes in there, hygiene, structural issues, environmental health, and so on. And then we look at One Health, which is actually now looking across all the health spectrum because they all impinge on each other. So One Health is trying to broaden it out. And then we talk about structural One Health because what really underpins this whole health pyramid is the economic system, the cultural system, the socio-ecological system that we have created as a species. And unless we address those, unless we look at those, we'll never sort out the reduction in problems that we need in order to have a society that's fair and equitable in relation to a life, okay? Whatever that life is. And why is it broken? Well, it's because all the money is there. Okay? A pharmaceutical company is not going to be impressed if we say to them, we're going to get rid of all those problems that you treat. How can they? If there isn't a headache, you don't have a pill to treat a headache. If you don't have an infection, you don't need the drug to treat the infection. But that's not how the system works. So if you look at research and development, it's all about what is the problem? Can I then solve the problem? Or at least ameliorate the problem? Because I know people will buy that drug to do that job. If we would focus more on preventative approaches and really fundamental structural approaches, you wouldn't need that system, or very little of it. I'm not saying you can get rid of it entirely, but actually what's happened is all of health is in that thing. Okay? Why do we have a broken National Health Service in this country? We have too many sick people. Simple as that. And it keeps growing. And of course, landscape is really important. And our human impacts are really important. And we need to understand this because it really is very fundamental. So if you look at the Ebola virus, for example, and I did some work with some same colleagues who did the paper, and we looked at, and FAO helped us, we looked at the Ebola outbreak, and we said, well, what else was going on at the time of this Ebola outbreak? And it was all at the time of the crisis. There was a food spike, cost issue, and it really changed a lot of the dynamics in the globalized food system. And you could see changes happening in the forest, and it was associated with an attempt by the government to provide palm oil to communities through increased industrialization of agriculture in this system. And there's a lot of DFID money, British government money came in, Tony Blair was investing from the Middle East, all sorts of things were going on in this region when the outbreak occurred. And of course, it was a very unusual outbreak, mostly with Ebola virus. A couple hundred people were affected. It's very much a localized problem in a sort of more natural forest edge situation in the Congo Basin. But this was because of the industrialization of the landscape. Motorbikes, roads, cities were connected. And so the virus very quickly moved into a human-dominated landscape where it became a major epidemic. So the root of the problem was actually in the way we were developing that landscape. That's the problem. Now all the focus was on vaccination and health systems to deal with the problem. So it's still that top of the pyramid, whereas actually the real issue is nothing to do with vets and medics, nothing to do with it at all. It's to do with the development agencies, the finance agencies, the banks, actually. That's what it's all about. Right? So it's important to understand these links. I've completed work with the United Nations Environment Programme where we did a pan-European assessment, okay, on environment. And this year it was about healthy planet, healthy people. So it was, they brought a health element. That's why I got involved. But if you look at environmental components of health, it's about a quarter now of human health problems directly linked with environmental problems. And we have climate change, air and water pollution, chemical exposures, ecosystem degradation, and this creates the environmental burden of disease. Okay, so if we look at Europe, we talked about China. 500,000 people have deaths annually attributable to air pollution. Okay? So don't look at China and say, poor old China. Think about poor old Europe. Think about poor old London. Okay? Because that is what's happening directly. If we look at Europe again, with it's a highly developed society, culturally, socially, and so on, but it is not able to protect its own land. Okay, we are seeing major losses of natural land, sealing of soil, destruction of soil at a rapid pace. Climate change and heat waves, it has real consequences. Actually more so than cold. It can be very, very stressful, particularly in city environments. And we're spending a huge amount now on disasters. I get involved in some interesting things. So I work with wildlife. But wildlife is a wonderful indicator. I started working in about 2012 on this Saiga antelope, which is in Central Asia. And this is an antelope that's been around since the mammoths. And we were interested because they'd had die-offs historically. So we're interested in saying, well, what's driving this? At least since the 70s, there have been sort of events that have been quite dramatic. But the population was big, a couple of million animals at the time. And then with the collapse of Russia, we ended up with quite a decline through poaching because they were starving. People were starving. They had to eat the animals. Anyway, whilst I was doing the work, we had teams monitoring the field, and we had an event in 2015. We were monitoring two herds, one of 60,000, another of 10,000. Both those herds developed disease. They were all dead within a week. Complete. The whole population was dead. There were 250,000 animals in this population, 30,000 survived. 30,000 appeared to be unaffected, but probably in different areas. So we've been working now for the last 2 years to try and sort this out. The proximate cause of death is Pasteurella. Okay? Pasteurella, hemorrhagic septicemia. That's not the real cause. There's underlying causes, and we're working. We're getting results now on climate factors, unusual climate factors causing bacterial proliferation, we think, and there may be some viral components to it. So we're beginning to build a picture now that is linked really to environment, to changes in the environment that are leading to these massive mortalities. Also seeing anthrax, major anthrax emergence, and I was up in Yamal in the peninsula in Siberia in the Arctic, and these are very traditional people. They live off reindeer, but they lose large numbers due to changing circumstances. The Arctic is changing dramatically, and so these are real problems affecting real people. Tomorrow, you're lucky I'm here. I go to Mongolia tomorrow. So they've had an outbreak of a disease that I have a research program on, mainly in Africa, but I do also some work in Central Asia, Pest ruminants virus, which is a plague of ruminants. And it can cause massive, 90% mortality in herds. Very, very severe and highly transmissible disease. So it's been spreading, it's been emerging. Something which I was involved in, rinderpest, you won't know much about that, but I was involved in the teams eradicating that, and we did achieve eradication in the end. But part of the reason the PPR has come back, I think, is the process of eradication has created a niche for another virus of a similar kind, very similar kind, to emerge now. So it's been spreading in Africa and spreading in Asia. Okay, so not everything we do, we celebrate our successes, but actually we also create opportunities for other biological entities. So this outbreak's happening at the moment, and this was in small livestock from September over the whole of Western. And this is about the size of Great Britain, that area you look at. Okay. So it's very widespread. And I'll come to you. And then we now have it affecting wildlife, spilled over into wildlife. The same species that died out pretty much in Kazakhstan, there are only 14,000 in Mongolia, they're being hit. We could lose 90% of them. Climate has been a component of this thing. We've had two very unusual weather patterns, last winter and this winter. So we think that might have been a factor in driving the way this virus has emerged. So these changes that we are creating have consequences, and that's very important for us to understand. So lots of vector-borne problems, and then food security. Ultimately, food determines our future. Biologically, that's what really determines a population. Availability of food. Right? When you run out of food, that's it. Okay, so food is really critical to us. So we're converting the world into a gigantic farm in order to feed us. That's what we're doing. But already you can see the stresses in the system. We call it globalization, and we say this is wonderful, but actually, if you look at Europe, 50% of our food is being imported, and we're using 4 times as much land elsewhere to what we've used for the same kilo of food in order to feed our population to the standard that we want. Okay? There just isn't enough land for that, for everyone. There isn't. It's just because we have power and money, and that's where your inequities come in. So that's where your global health issues come in. Okay. And the irony of this is you look at the obesity issue. Well, the roots of the obesity issue is very clear. It's simply about our political and economic system. That's what generated it. It's not an individual problem. It's a societal problem. And we have to address that. And all the diseases that are associated with the food system. And what's ironic as well, where we have the most productive soils, we put the most people. And we end up capping the soil. Right? So our whole structural development, our urban development, the most fertile soil in Great Britain is in the Thames Valley. What do? We put a huge city. Do you see much soil? Zero. Okay. Crazy. We waste, and we have toxic diets. So how are we going to implement One Health in practice? Okay, we need to research it. We need to get a proof of concept. We need to teach principles, and we're beginning to do that within the academic environment. We need programs. We need to genuinely involve people in health. So we need to stop putting health in a box and saying that's the responsibility of the vet, that's the responsibility of the doctor. Because they can do a job, but actually we need everything. It should not be given to the pharmaceutical companies, given to the professionals. We need to communicate about it. That's what I'm doing to you. And we need to be more inclusive generally. And we need indicators. We need to have some simple indicators. Soil fertility, air and water quality, biodiversity, microbiome, GBDs. These are indicators. Right? We've got them. They're all looking bad. Okay? So we have to find a way to reverse that. And that's what we have to focus on. NEO is a project which the Royal Vet College, Barbara Hastings, leading, and it's a network for evaluation. So we're trying to develop intellectually, how do we work out metrics, how do we proceed with it? And you're welcome to go to the website and have a look. Sustainable Development Goals are basically a One Health paradigm. We're saying, finally, the international community has recognized that the way we're behaving is not sustainable. So they put sustainable in front of development. So, okay, they want development, but they want it to be sustainable. Okay, so we're all talking about how do we do that. And that's good. That's the first step, I think. I'm not sure people appreciate what that really means. But it'll come. And I don't see it as a major suffering, actually. I see it as a very positive development, ultimately, because you will get healthier societies as a result. But in order to do that, we have to change the legislative structure that we have in society, because at the moment, all the legislation, all the resources, all the energy is going into the well-being of people, not of the environment. And until we address that, and so if you like, a global health issue to me is like planetary health, it's that we have to address the fundamentals, and then our well-being will come naturally out of that. But you can't use the environment to create well-being, because ultimately you lose the fabric that supports you. Okay, so that's a problem. That is a major, major problem in terms of our global system. So, solution. Well, of course, we can start by convergence in relation to all these things like global health, One Health, eco-health, planetary health. They're all the same. Okay? They're all trying to solve these problems because there's inequity between animals, people, between different peoples, etc., etc. The principles are all very much the same. So we need it under one hat. Now, One Health can be an umbrella. It could, I don't care what the name is. It just is bringing things together, saying this is where we've got to move, and we need to work out, how to measure these things. We need to get the policy and the science. We need to get interventions. We need to communicate. We need the whole of society involved and participate. So, those are the solutions, but it will take time. It takes culture change. We need to raise visibility. We need funding. You need coordination. You need wholesale action, and these are the things that critical needs for whatever health. Very important. All right. So that's it.